Good afternoon, everyone. Welcome to the City of Healing, where the city resides within. This is your sister, Sinette and Angela. I hope that everyone is having a beautiful, rainy, if not rainy, but a beautiful sunny day this Saturday afternoon. Wanted to come forth and do a brief share. I know so much is going on in the world today. I could talk about it, but I'm not at this time. Maybe perhaps another share, but it's just so much going on. It's hard to ignore, things that are being done and not being done, and that's true and not true. It's just so much, but life still goes on, and we have to continue other types of dialogues as well to not focus in and give that type of energy towards that. There go one of my butterflies that and he landed right on my head. I don't know why it's here. It's winter time and he shows up right in the middle. Anyway, wanted to do a brief share, talk a little bit about my dental hygiene and my process that I normally go through. But I mentioned in my previous video about, my dental health and the importance of it and certain tips. And I wanted to go in instead of showing, because I don't think it's that cute, to show, brushing teeth and all of that. But anyway, I decided what I'll do is talk about it a little bit as to some of the things that I do. My routine is not necessarily things that I do necessarily every day, but it can be a general idea of the things that I've done or do that's been working for me. One of the things that I used to do a lot, and I still do now, is what we call oil pulling. And I make sure that I get unrefined, organic, cold press oils to pull with. As we know, oils pull or detoxify the body. And like I said, coconut oil is the number one thing I have because it has lauric acid in it. And we know that lauric acid is antifungal, antimicrobial, so bacteria, viruses, parasites, etc. We know that that's one of the benefits of coconut oil. I also use sesame oil, but not as much as coconut oil. Sesame seed oil is basically a great antioxidant, and I use that mostly sometimes at night. I don't do coconut oil or oil pulling as much as I used to, at least 2 or 3 times a week, and the sesame seed oil at night 1 or 2 times a week, perhaps. But that's the general idea of what I do with oil pulling. Oil pulling, as I mentioned, pulls toxins out, gets into in between the teeth and in the gums. It absorbs, gets into the bloodstream, because as we know, when you put anything inside of your mouth, especially if it's oil forms, it's a magnet and it extra pulls out, those viruses and toxins. And that's why you swish it around. Generally for me, 10 to 20 minutes. Average for me is about 10 minutes. And it does the job. Some people say it whitens teeth. That's not generally my goal, but I've seen, and people say, my teeth are white sometimes more than others. But that's very good with very good dental hygiene, pulling out those bacteria and viruses to promote good dental health as well as body health. As I mentioned in my previous video, your oral health with the toxins that builds up inside of your mouth affects your general body. And that's research done on that now, and we are talking about that more now. It's not much so a reality and accepted as much, but indeed it is. And oil pulling is definitely one of those things that benefits the body in that way. I know some people also do oil washes. Instead of using soap and water, they use oil because oils attract oils, and it acts as a magnet and pulls out toxins. So that's why some people use oils when they're pulling off their makeup or they feel that their face is real extra dirty, they'll use oils as magnets to track other oils and pull out dirt. So that's a great benefit of using oils for good dental hygiene. Just a little bit about that. There's so much more that can be said about it, but I'll just limit it to that as well. And then after I do my oil pulling, I definitely rinse out. Well, first, before that, I have to say I don't spit it in the sink, of course. I do either spit it in the bag and put it in the trash can. Sometimes I go for walks, I'm in the woods or something, I'll spit it outside in the woods somewhere where nobody else walks, of course. And afterwards, I will rinse my mouth out with salt water or baking soda water, because I believe that kind of neutralizes and balances the pH in your mouth, because you don't want to strip your mouth of all bacteria, because we need some, but it gets rid of, a lot of the bad bacteria, but not as much. And I know at some instances, and there may be two reasons for that. When I first started doing oil pulling years ago, I would get, thrush, and I'm not sure if that's because, or yeast in the mouth, if I stripped my mouth of all the bacteria in my mouth that it caused the oil pulling, or I pulled up toxins or parasites or yeast in my body or in my upper intestines into my mouth, and it manifested as such. So that's something to think about as well. You may want to, if you have a weak digestive system or SIBO or a lot of yeast, you want to be really careful about that, because it can build up in your mouth, especially when you detoxify the body. Just like anything else, if you detoxing, you expect symptoms such as breakouts on your skin. So that's something just to consider. After you oil pull, you rinse your mouth out to bring back the balance in your mouth with sea salt or baking soda. And of course, after then, I don't do a lot of flossing. I do sometimes, but I don't do a lot of flossing. Specifically why? If you have weak gums, if you have bleeding gums, if you have gingivitis, you're going to get those extra cuts from flossing, and that can promote more absorption of bacteria and germs into your gums, which absorbs into the body as well. So that's why I don't generally do a lot of flossing, because that can promote more absorption of toxins in your mouth to get into the bloodstream. And all of this, of course, is not any medical advice. I'm just sharing what I do and my rationale. I haven't done any official research on it, but what I've seen that works for me and kind of makes sense for me. And of course, I do brush. And I think it's very important to use a good toothpaste without fluoride if you can. I don't have my grandmother's recipe for washing my mouth out with soap, and I don't use soap anymore. But sometimes I use a teaspoon of salt or a teaspoon of baking soda and some water and brush my teeth with that. Or I use the Arm & Hammer baking soda toothpaste, but that has fluoride in it. So I didn't grow up using fluoride, and I try to stay away from it now as much as possible. So I use like a Jason's toothbrush. Also, I use sometimes a periodontal mouthwash gargle. And also I make sure I gargle with pure Listerine, because, it gets the back of the mouth or any bacterial viruses lingering around. You don't want that to be around. So specifically at night, you want to make sure that you gargle before you go to sleep. And as I mentioned before, I taught with my students about making sure that we promote good dental hygiene for our patients, because the mouth harbors disease, the body absorbs it, and can contribute to a lot of hospital-acquired infections. So mouth care is very, very, very important, and it's something that I emphasize a lot, even for, master preparing nurses and BSN preparing nurses, to instill that importance of dental care and how much it affects the general health of the human body. So those are just some things that I do from day to day. It changes up. I don't necessarily have a routine regarding that. Also, there's things that you can ingest. I mentioned definitely probiotics and certain herbs, but with any herbs, any over-the-counter medicine, you want to consult with your doctor because there could be contraindications or side effects to it, specifically to your general health or your medications that you take. So you definitely want to check with your doctor. But systemically, when you're ingesting an herb, you want something to be antibacterial, antifungal, in general. If you have like any type of non-febrile infection going on, which we do, you could help kind of kill that off. Anything that's hiding within the gum lines or within the bone, you can ingest certain herbs that'll help with that, such as berberine is really excellent for that. I'm not telling you to take any herbs or anything, but you can look. This is one, I have several herbal books, but this is a really good one. The Last Book of Herbal Remedies. But this is a good book, but there's definitely more. I just happened to pick this up first. But you can look up in the herbal book, best herbs for promoting good dental health or curing gums or curing teeth. And it lists several herbs here that do, such as bilberry, aloe vera, cattail, bloodroot, let's see, caliandria, wild ginger, let's see, watercress, yerba santa. Those are just a few of the herbs that you can consider researching, going into, that help heal dental care. But as I mentioned, you definitely, and I mentioned in the other videos, you definitely want to have a good probiotic because your digestive health has a lot to do what's going on in your mouth, and what's going on in your mouth has a lot to do what's going on in your whole body. So taking a good probiotic is important. Also, the herbs I just mentioned, encourage to research and consult with your doctor about. You want to make sure you're getting your D3 in. You want to make sure that you're getting your K2 because that decreases the amount of plaque that builds up, thus the bacteria that grow in your mouth. So K2 is important for that, and making sure that the calcium and the vitamin D gets inside of your bones and not into your bloodstream as much. Collagen is also important, as well as magnesium, just to name a few. So I just wanted to come forth and just mention some of those things that I do. As I mentioned before, I know I don't have the most perfect teeth. I don't have the perfect white or aligned teeth, but I'm very pleased with my aesthetics of how my teeth look now, as well as my dental health that I'm continuously working on because, you know, as I mentioned several times before, I was in my late 30s or 40s, you know, the dentist, or early 40s, something like that. I should keep up with it, but, you know, I didn't. But, you know, the dentist recommended over 10 years ago that I should have all of my teeth extracted. And I thought that was really weird because my teeth weren't really that bad. But he said that I had unhealthy gums and I needed a gum implant. I was like, wow, this is interesting. It was something going on with, because I had two aunts as well, specifically one of them that had really good looking teeth, but her doctor told her to extract all her teeth. But anyway, and several other people mentioned at one point, at least about 10 years ago, about, you know, getting all your teeth extracted. Anyway, they said I wouldn't have my teeth, I have poor dental health, there's bad, you know, overall health. So that's why I should have all of my teeth extracted. Well, I still have all my teeth except for one, you know, and no loose teeth, no gum pain, no tooth pain, no swollen gums, you know. Overall, you know, my dental health is pretty good. I'm still working on some things, but overall, I'm doing okay, and I'm very happy that I did not have all of my teeth extracted or have a dental implant at this time. I'm not saying don't trust your dentist. I'm not saying don't go to your dentist. I'm just saying what helped for me. I think it should be a collaboration. I'm hoping and I'm thinking that, and I think someone did mention that dentists are now talking more about D3, at least. A lot of people don't talk about K2 as much, but that conversation is coming up more. A lot of people, some people are talking about collagen. Some people are talking about oil pulling. I think people have been talking about oil pulling for quite some time, but I think there's more research on the true benefits of it. But anyway, do your own research, consult with your doctor, consult with your dentist, but also I say consult with yourself and use critical thinking about your own health. Anyway, that's it for now. Take care. And I hope you all have a great evening. Take care.